Hello, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed for private practices to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. I'd like to now introduce our speaker for this session, Dr. Justin Holtzman. Dr. Holtzman, please take it away.
Thank you. So my name is Justin Holtzman, and I'm going to be talking today about support staff retention. So first, a little bit about me. I graduated from the University of Michigan with my undergraduate degree in business in 2004. I then went on to medical school at the University of Michigan, and I graduated in 2011 from the University of Michigan Medical School, as well as the School of Public Health with a master's in Health Services Administration. In 2014, I completed a residency in internal medicine at the University of Massachusetts in Worcester, Massachusetts. I currently own and operate independent and private multi-specialty practice in and around the Boston area. So I'd like to start out with a brief story. So the year was about 2016, and I was hired by a large hospital system to be a primary care provider in a suburban practice. And within a week or so of starting there, a few very strange things started to happen. The support staff came up to me and they started telling me about how unhappy they were while working there. They very openly shared with me that they didn't get paid enough. They said, for example, that they only received a 35-cent an hour raise for the year, and for their Christmas bonus received a $5 Dunkin' Donuts gift card. They felt that what they did didn't matter, that they would go into work and do what somebody else told them to do, but never had the opportunity to actually take ownership of their work and make changes. They said that they didn't feel valued. They clearly weren't happy. After working there for a while, you could really tell they felt no ownership in their work. They weren't empowered to make any changes within the organization to improve the work that directly impacts them. There was clearly no sense of accomplishment among the staff. They had no control over their environment. There was minimal communication between the front office and the back office, and certainly minimal communication between the support staff and the medical staff. It was almost as though they felt like they were there to stamp a time card and then just leave. So I didn't last very long there. And I left after about a year, and I sought to create Holtzman Medical Group. And when I started this group, I created it with two main pillars. One is I want to make a great place to receive care. And for that, there's a lot of low-hanging fruit. That's probably a whole other discussion, but it seems that if you're available to the patient and you treat them well, they're very happy. But the other one was I wanted to make it a great place to work. And so the question I came up with was, how do I do that? So I did what any doctor does, and I went to the literature. And so in researching the literature and the studies about what's out there, I came across Sheena Iyengar. She's a social psychologist who's currently a professor at the Columbia University Business School. And her research focuses on choice. And she posits that choice is a hardwired, critical aspect of people and making them feel good. And she states that you can take the components of choice and apply it to the workplace to be able to create an environment that is much more conducive to getting the job done and where people are happier. And so the crux around what she says is create an environment where people are empowered to make the decisions that they can make to get the job done, and don't micromanage. And so she does this through sort of the following principles. So first, she says provide options, and I think this is in some ways pretty common sense. I do it all the time with my 5-year-old. If I ask my 5-year-old to just go clean up his room, he runs away and laughs and doesn't do it. But if I say to him, you can either clean up your room or go wash the dishes, all of a sudden he feels like he made a choice. And the choice is his to do. And he gets it done and he does it and he's happy about it. It's the same thing in a work environment. Provide options. Don't just tell people this is what you're doing, but explain to them, would you prefer to do this? Would you prefer to do this? Or maybe you should do it a different way, which really goes on to the point of fostering autonomy. And I feel like this is a key factor that she brings up in employee satisfaction. Provide employees with the autonomy to figure out how to get the job done the best way that they can get it done, and provide them the necessary resources. So rather than saying you're going to room the patient by doing A, B, and C, instead start out with saying the goal here is to room the patient. How do you think is the best way to do it? A very important point that Sheena Iyengar makes is to address biases in the workplace. And this is very difficult because there's plenty of inherent biases that people come in with into the workplace, but there's also biases in just how we think, whether it's anchoring bias or availability bias. These are things that everybody should be aware of because they affect people in different ways. We should encourage transparency to help build trust rather than hiding the performance of the business or what's trying to be done. Instead, let the employees know what we're trying to do and really empower them to come up with the solution. And then, of course, create a work-life balance and have choice in that. And this is huge. When employees talk about lack of satisfaction in their workplace, a lot of it revolves around the lack of control they feel, and creating the opportunity for employees to be flexible in that work-life balance is key. So after looking at the research, we decided to take a look at what stores and what organizations do a really good job at employee satisfaction. And the one that kept coming to mind was Trader Joe's. Now, if you haven't been to Trader Joe's, I highly recommend it. It is a retailer, a grocer. They sell groceries. But the interesting thing is, every time you walk into this store, no matter what, the employees are always happy and helpful. You could be walking down the aisle and you have an employee stocking shelves, a very menial, repetitive task, and they'll sit there and engage with you and not even miss a step by taking an item off the shelf, opening it up, and letting you try it, which I must say is extremely effective in getting you to buy something. They've been rated as the 3rd best large employer in retail and wholesale, according to Forbes. They have the highest customer satisfaction in the supermarkets category, according to the Customer Satisfaction Index. But how do they do it? How do you get these employees to be so happy and so friendly all the time? And this is a busy grocery store. So we talked to them, we asked them, we looked at what they do. And there's a number of things. One is they pay really well. Part-time crew members can make up to $24 an hour starting. That's twice the highest average minimum wage in the United States. The store managers make over $100,000 a year. They make sure they have variety built into their tasks. Instead of having one person do the same task day in and day out all day, everybody is trained to do a variety of tasks, whether it's checking people out as a cashier or stocking things, or even just cleaning. It helps keep people engaged, prevents boredom. They also provide excellent benefits, whether it's healthcare or paid time off or flexibility. but also they search out people that are outwardly nice. They feel that it's hard to train somebody to be nice, so they look for gregarious people that are there to be friendly. They also promote from within. This means that when somebody starts working there, it's not going to be a dead-end job to them. 78% of supervisors, they call them mates within the store, come from a level where they started out as a crew. 100% of store managers, they call them captains, are promoted from the pool of mates. One of the employees says, it almost doesn't feel like work. It feels more like we're hosting a party and the customers are the honored guests. Employees are encouraged to be themselves instead of fitting some corporate mold. There is no script, said one employee. As long as I make sure the customer is having a great time and I'm emphasizing Trader Joe's values, I can talk to people about whatever I want. And they really care about their employees and they make sure that the employees feel that. One employee remarks, almost every manager I ever had somehow made me feel like I could tell them anything, personal or otherwise, even though I didn't have a lot in common with them. All of that together makes for a great experience. John Basilone, the president of stores, says, you combine no layoffs with pay, benefits, and a supportive, fun environment, and people tend to want to stick around. So then we looked at a company like Costco. Costco is a general merchandiser and grocer, but they sell things a little bit differently. Aside from $1.50 hot dogs, comes with a soda, they also provide large bulk purchases. And they do this in a warehouse setting that's generally no frills with a minimum number of SKUs or stock keeping units. So rather than having a lot of one item, they have one or two iterations of that. And when you walk into a Costco, you get the same feeling, not quite the same as Trader Joe's, but you get the feeling that the employees are empowered to be able to get the job done. So Costco is known, they're famous for their return policy. They'll pretty much take back anything. Now, of course, there are limits, but the discretion seems to be left up to their managers and their employees. And the best example I can give is I bought a steak once at Costco, and I got home, I went to cook it, and it was clearly rotten. I didn't know it at the time. It was so rotten, I threw it out. And I went back to the store the next time with my receipt, and I said, hey, the steak was bad. I couldn't eat it. And they said, great, just bring back the steak and we'll give you your money back. Except I didn't have the steak. I threw it out. It was rotting. It was gross. And even though it was clear that it was not within their policy to take back a steak that doesn't exist, the manager, not the manager, the employee, using their discretion at that time, still refunded my money. Yes, they probably lost $20 on the sale, but clearly they gave the customer for life. Costco's been rated as the best place to work on Glassdoor, which is an employer-rated website from 2012 to 2022. 83% of Glassdoor reviewers approved of Costco's CEO. 77% of responders said they'd recommend the company to a friend. Clearly, they empower their employees. They give them above average pay, time and a half on Sunday. They even get a free turkey on Thanksgiving. They have flexible hours, paid time off. The staff and the management clearly works with the employees to create a schedule that works for them. And the end result is an excellent experience for both the staff and the customers. Some employee remarks on Glassdoor are, Costco is an amazing company to work for. Top out pay is $26 an hour, which is extremely competitive. There's a great deal of security. Health insurance and vision benefits are also pretty sweet. Another employee remarks, Costco does a really great job of taking care of their employees with a matching 401k benefits. They promote from within. You can become a manager within a year or two, and there are many departments. So if you don't feel like being a cashier, you can request a transfer. So we see a lot of the aspects of choice that Sheena Iyengar was promoting present within these companies: empowerment, flexibility, work-life balance, transparency, and we continue to see it with other companies. So another company we looked at was Ritz-Carlton. And before I started the practice, I took my office manager at the time and we went out to have dinner there, and we really took a look at what they did, how they did it. So Ritz-Carlton's a hotel. They also have restaurants in their hotels typically. But when you go in or stay at a Ritz-Carlton, it's really remarkable how every employee is able to create a great experience. And it's clear that they do this through empowerment. So if you look on Ritz-Carlton's website, there's a number of values, far more than I can put on a PowerPoint slide here. But I was able to take out some of them that I think really encompasses sort of the values that we've been talking about. So just to read these off, some of their values are: I build strong relationships and create Ritz-Carlton guests for life. So that puts the onus onto the employee and empowers them to build that relationship. And here in the second bullet, I am empowered to create unique, memorable, and personal experiences for our guests. It says it right there that their frontline employees are given the authority to do what's necessary. And in fact, if you research it, there's a quote unquote rumor that every employee has a budget of $2,000 to help fix anything that's wrong with a guest to make them better and make the experience memorable. I continuously seek opportunities to innovate and improve the Ritz-Carlton experience. This really involves ownership of the work. It says to people, you can take a look at the way things are done and make it better. I own and immediately resolve guest problems. Again, not having to worry about going up through various layers of management to be able to fix a problem, but instead owning it right then and getting it done. I create a work environment of teamwork and lateral service so that the needs of our guests and each other are met. So this goes beyond just making a great experience for the guest, but it goes to making a great experience for each other. What can we do to create a work environment that really fosters collaboration and communication? I have the opportunity to continuously learn and grow. I am involved in the planning of the work that affects me. Again, empowering employees to create an environment that works for them and allowing them to design the work. And of course, I am responsible for uncompromising levels of cleanliness. So we also took a look at what I think is one of the greatest companies, and that's Nordstrom. And Nordstrom is a retailer of high-end goods and apparel, but they're known for having excellent customer service. And they're famous for their handbook that says, use one rule. Use good judgment in all situations. And that's it. And I think that really encompasses everything about empowerment and allowing employees to think about what needs to be done to make the situation better. So after looking at various companies, looking at the research, I started the company, and I decided after a little while, ask our staff, what do they want? What are their values? What can I do to make their environment better? And interestingly, we see a lot of the same themes come up. They want excellent compensation. Everybody wants to get paid well. They want a helpful, collaborative culture. They don't want to feel as though it's a zero-sum game where they're fighting against other people within the organization. They want to have a vested stake in the practice. If the practice does well, they want to do well. They want to be empowered to make decisions and decentralized decision-making. This means that they don't want to be stuck with multiple layers of management just to implement anything. They want to be able to see, I can do this better. This is how I do it better, and implement it right then and there. They want to be able to problem solve. They want to make sure that there's transparency and open communication, not as though they're trying to hide anything or that the company is trying to hide anything from them. And they want equity and autonomy within the practice. They don't want to feel as though there are any inherent biases when they go into work, and they want to be able to work independently. So how do we do it? Well, we pay well. Our pay starts at $22 an hour for college students, and those are part-time college students. But more than that, we pay for their lunch. I don't mean we buy their lunch, although we do on occasion, but we pay them during their lunch hour. And I'll never forget that we hired a college student to work part-time. And after the first couple of weeks, the pay period came up and I asked her for her hours. And she gave me her hours that she was there. But she said, well, I was off for an hour for lunch here and I was off for an hour for lunch there. And I had never explicitly stated it, but we never deducted for lunch hours. And I actually feel very strongly about this because it's not as though the employee can go and get another job during that hour. And it's not like they can make useful, productive time of their lives during that hour. Sure, they can go out and get lunch wherever they want. They can go and run an errand if need be, but they can't earn money during that time. So I feel an obligation that we should just pay them. And at the end of the day, am I going to really be out the $22 and feel it? No, but at the end of the day, they'll feel a lot more value from that. We cover 100% of health insurance and disability insurance for employees who need it. And this is a recent development that we've been able to implement in the last year and a half. I feel very strongly, and everybody does in our organization, that as a healthcare organization, we should be able to cover health insurance benefits. And we use an excellent health insurance company, and we pay 100% of that for those who need it, even for our part-time employees. We also provide meaningful annual bonuses to people. This is either based on performance or based on time with the company, but nobody gets a $5 gift card. In addition, we provide items that are branded that our employees want. So for example, I wanted to buy us jackets and coats for us to wear that have our name on it and the company name on it. And rather than go out and find the cheapest one and give it to people where I knew it would break apart in a couple of years and they probably wouldn't wear it out, I asked the employees, what do you want? And we all wanted Patagonias, which is a higher end brand. And so we all got out and went and ordered the Patagonias and we had our names put on them. Yes, it was a little more expensive, but now when people go out after hours or on the weekends, they're wearing those Patagonias and they're happy and they're proud about it. We have minimal layers of management. So when you take a look at our support staff and our operations staff, there's my operations director and everybody else. Yes, at some of our locations, we may have a sub manager to help with other responsibilities, but the staff doesn't report to them. This means that if something needs to get done, they can go straight to the top. And there's no reporting to me. Instead, we're all lateral with each other so that people don't have to go up a whole chain of command. We make sure that everybody has the ability to design and implement new processes to get the job done more efficiently. So when people start as a new employee, we explain to them that we have a job. The goal of the job is to do X. For example, get the patient roomed. Here's the tasks or the information that we need. Here's traditionally how we've done it. But if you see a better way to do it, let us know and try it out. And if you need resources to get this done in a more efficient way, let us know and we will do everything we can to provide you with those resources. The best example that I give is when I started the practice. We use an electronic medical record system. And so any paper records that come in get scanned in. And so I purchased a printer that also did scanning and copying, and the copying and printer works great, but the scanning function is slow. And somebody suggested, why not purchase a high-speed scanner? And so we looked into it. It was a little expensive, but we purchased it. And now a task that would previously take an hour takes about 5 minutes. And I think the staff is much more appreciative of the fact that they don't have to sit there by a scanner for an hour doing mind-numbing work, scanning documents into a chart when they could be interacting with patients and making it a better experience. We make sure that we have regular meetings to discuss new ideas and concerns, and we implement ideas immediately. In addition, anybody within the organization can add items to the agenda. We do these at a minimum monthly, We discuss any topic that anybody wants to discuss. We see how other stakeholders within the organization might be affected, and then we come up with the solution as a group. We also have a monthly social budget of $1,000 per location, where we go out and do purely social activities that the staff gets to decide. Examples include a trivia night where we went out to a local bar and we drank and ate and had a good time. Or our holiday Christmas party where we went over to somebody's house, it was catered, we did a white elephant exchange, and everybody had a blast. At the end of the day, nobody works for me. Instead, everybody works with me and with each other. There's no one person telling you how to do a job here. And we have to understand that people may not work in the same way that I would work or you would work, but instead, they may come up with solutions that are different than you want, but still get to the same end goal and most likely do it better. And we have to be okay with that. So, what are the results from this? Well, we've gone from a practice of one doctor and one assistant seeing patients once every week to once every other week to a multi-specialty group with right now 3 MDs, 3 PAs, and 1 NP. We have 3 locations. We're expanding. We hope to hire 7 more practitioners in the next 2 years. We've gone from $17,000 in gross revenue in our first year to $2.9 million in revenue last year. We've been profitable every single year. We were the first provider to give COVID vaccines in the Boston area when the vaccines first started. To date, we've given over 40,000 vaccines, and we've been able to form partnerships with state government, local governments, universities, and numerous others. And to this day, we're still giving COVID vaccines to those who need it. We have over 500 Google reviews with a 4.9 star average. And I think it's important to note, we don't scrub those reviews. Instead, everybody who comes into our office is asked to please rate their experience and also to let us know if anything went wrong. And when something does go wrong, we address it right away. And the interesting thing is, when you address it, if somebody does leave a negative review, they'll take it down. And we never ask them to take it down. In fact, I tell people to keep them up because this is an honest review, but they still on their own accord want to take it down. We have over 1,300 ZocDoc reviews with 91% giving 5 stars. And this is all occurring in an environment that the large hospital that I worked for before told me that no primary care practice could ever make it anymore in this particular area. So this is a photograph of us at our trivia night and everybody having a great time. We divided up into 2 separate teams, and one team won 3rd place, which I'm very proud of. And we got a $15 gift card that we used to help cover the bill. So here are some references. So thank you.
And that concludes today's presentation. Thank you so much, Dr. Holtzman, for your time and sharing your experience and your story for your practice. We encourage you to check out the discussion board and engage with Dr. Holtzman and your peers. He'll be holding office hours every Thursday from 9 to 10 a.m. Eastern. So whenever you have questions or comments, that'll be the time that he'll be able to log in and take a look. Next slide. And please check out some additional resources and support at stepsforward.org. Thank you and have a great day.